patients are gravitating towards Makoplasty for a few reasons. Number one, they know it's minimally invasive. Number two, they are very well aware that this is robotic-assisted surgery. There is a robot in the room that weighs over 1,000 pounds and it has a mechanical arm. And at the end of this arm, there's a burr that we control that will essentially allow us to remove the appropriate amount of bone at the appropriate angle that is unique to the patient, so that these implants will match perfectly to the contour of that patient's knee. And what happens initially is that when they see me in the office and I look at their x-rays or their MRI, and I suspect that they're a very good candidate for this type of a procedure, I will send them for a CAT scan. A CAT scan is done, and the CAT scan is essentially done from the hip joint down to the ankle joint, and it concentrates obviously also on the knee. And all that information is transmitted to the robot. And the robot, which resides in the operating room, has a monitor next to it that has all your information from that CAT scan. And essentially a 3D model of your knee. Once all that information is placed into the computer system and the robot, and a 3D model of the knee is created, we then can proceed with the surgery in the operating room with a minimally invasive incision. With the knee exposed through a small incision, we can then map out the knee with a special probe that communicates with the robot, and multiple spots on the end of the shin bone and multiple spots on the top of the the end of the thigh bone and the top of the shin bone are registered into the robot, and it combines the information from the CAT scan and the real-time information from the knee that's been exposed, and that information then finalizes your 3D knee. So when your knee is being manipulated in the operating room, the robot in real time will observe and monitor that mobility, and you can watch it on the screen. This technology allows us to be able to produce outcomes that are, in my opinion, exceptional. Radiographically, when we see these images in our office and we take x-rays, we see that these implants have been precisely placed to the end of the femur and the top of the tibia, and we know that if these implants are appropriately aligned, the likelihood of success and that these patients do well long term is very high. So the benefit of the Makoplasty and the robotic arm is being able to reproduce the positioning of these implants in essentially almost in an exact fashion, so that we can feel comfortable that this patient has the best chance of having longevity with the implant that's been applied.